ECP TV, and I am here again today with Penny Story. Hello down there, Penny. She is a political activist, and she has brought in for us today Ivette Lozano, the Dr. Ivette Lozano, and you probably remember her from the last show. She had a lot to say, and she's going to tell us a little bit more. First of all, either one of you have the chance to speak about this. There has been a video that has been going around. I believe I saw it was from a doctor with the World Health Organization about the blow dryer method of raising your body temperature because your sinus cavities is where the virus starts. So tell me a little bit about what you guys think about that idea and who would have put out a video like that if it's inaccurate.
Well, it's been brought to my attention that if our body temperature is 98 point whatever, and the blow dryer says 80 degrees will kill the virus, common sense says that may not be good
But it said 132, I believe. Yeah, that's still, I mean, because they were talking about it's, blowing 132 heat up into your in your nasal, but that was also about blowing or spritzing water.
Please don't do this. Please don't do this.
Okay, good.
So I just wanted to see how far these two ladies would go. I'm going to have to stop here.
Okay, good. We want that.
Tell us, doctor.
Tell us, doctor.
Okay, so I think it's pretty obvious. We want to use our common sense. We don't need to have a medical degree to know that in the wintertime is when we see more viral activity and we have more diseases that come from viruses. And this is because obviously our immune systems go down the colder the weather is. And so this COVID-19 that we're talking about, and we know that it is temperature sensitive and that it doesn't exist outside of 80 degrees. And so that's actually wonderful news to know, because what that tells us is that if we are active and healthy and walking outside or spending some time outside in the sun, this actually will prevent us from getting viral infections and viral diseases. And so I encourage people to do that. And so there are a couple of things that we can do. And I noticed that you have your little hand sanitizer
I have it here for whoever wants to use it.
And I'll be real honest, I'm not a big fan of hand sanitizer.
Right.
I really like the hand washing.
I'm surprised there wasn't like a run on soap instead of this.
Yeah, so when you wash your hands with soap and water, the bacteria are washed away. And sometimes this can be a little sticky and it can actually leave stuff on your hands. So if you have the ability to wash your hands, I think that's great. Okay. We have to be really careful with our older population. And so one of the things that we need to do, yes, I know it's getting kind of touchy out this panel. But here's some really smart things that we can do for our grandparents, okay? So obviously our grandparents get sick a little bit easier than we do because their immune systems are lower because they're a little bit older. And so please do me a favor, don't bring your children, your grandchildren to see their grandparents if they've got quote, quote, allergies, which may be a sinus infection, maybe a little bit more than just allergies. Don't bring that to grandma and grandpa's house. Let those kids stay home. Make sure that they're nice and healthy before you bring them in. Most of the patients come into my office that are elderly that get sick from a grandchild that has come and visited.
Okay.
So instead of doing this major social distancing, what I highly encourage us to do is to keep the grandchildren away. Now, one of the things that I find very fascinating with all of these regulations from the government is that we've closed down our schools and we've left our daycares open. That makes absolutely no sense whatsoever to me. In schools, we have nurses and teachers that are highly qualified, but lots of times in daycare centers, we have tons of children in large groups, semi-unsupervised, and definitely not washing their hands.
I think I have read that each daycare is only allowed to have 10 children. Now that is good or bad, whatever the case may be, but I don't think they're all in one big clump.
Get your children out of daycare.
I mean,
get your children out of daycare.
This is a good time to get to know your children.
Absolutely.
If you're sheltering in place, get to know your kids. Right?
Yeah, it's family time again.
Yeah, and I realize that some people don't have the opportunity to stay home and raise their children. I was a single working mom, and so I understand that totally. But during this time where we are concerned, if we're concerned enough about closing down the schools, we should not send our children to the daycare.
Yeah, that is an interesting observation. That there are a lot of interesting observations going on right now among humans as a group, I think. So let's talk about, there's 303 confirmed cases as of today, Friday the 27th, in Dallas County, and there's 10, I believe there might be a few more after the weekend in Ellis County. Don't quote me on that, I didn't say it because I don't know it for sure, but 10 for sure. So what is the ratio of people that are like confirmed and dying and confirmed and going home because they're okay?
This is a very important question. So how many people are positive or negative is going to depend about how many people get tested. Well, the reality is that not every doctor or Dallas medical clinic has even the kits to be able to test for the COVID-19.
Okay.
I will tell you that in my office I have 20 20
Okay.
kits, 18,000 patients. Those numbers
Wow.
don't jive.
No.
And so here's what's happening right now. The medical supply companies are not giving every physician the COVID-19 test. In fact, they're actually limited, and this is per regulation from the government on what clinics they can actually give these COVID-19 kits to. And they're asking that clinics that are very high volume, that we're going to give 30 positive test kits, are the only ones that are going to be receiving kits right now.
Okay.
So these numbers are completely skewed.
Okay.
I want the public to remember that every year we have between 40 to 60 to 80,000 deaths from the regular flu.
Yes.
And this is very serious. And I'm actually really excited that we're talking about COVID-19 because it's almost like we're giving the public an education on how to take care of themselves from a viral standpoint of view. How to wash your hands, how to be distanced if you're coughing, don't cough in front of
Right,
somebody.
exactly.
This is all wonderful information that we're going to take home. But what I don't like that we're doing is this unbelievable scaring of the public. I mean, I have patients that are hunkered down in their homes, their doors are locked, they're not letting their grandchildren or their children or their neighbors in, and it's such a hysteria that it's actually detrimental. These patients are having elevated blood pressures, they're getting ulcers from all this horrible news. Well, somebody needs to be a little bit more realistic. You're not going to die of this. You have to be open-minded to. We have therapies that we can use. There are medicines out there available to you.
Right.
You don't have to go into total isolation over this.
Right.
Get rid of the hysteria and let's educate people on how
Okay.
to stay healthy.
And another thing about the United States versus other countries is that we do have a social distancing policy here, just because I know when I go to other countries, people are way too close to me, and
I
that
wanna
was
talk to
way
you about
before
that.
COVID-19.
So we definitely have to talk about this. So
Okay.
we like to compare apples and oranges here, and we just can't do that. And one of the
Right.
things that I hear is, well, look at all the people dying in Italy, and they're all older. Yes, but let's look at the medical system in Italy. Let's look at how the doctors have to practice there.
Right.
In a room such as this, there would be about 40 people. They would be right next to each other,
Mm-hmm.
bed, with a little bitty curtain between it. In the United States of America, most of the emergency rooms and most of the hospital beds in the hospitals are either private or semi-private. And so you have excellent hygiene between patients because there's just, they're enclosed in different rooms.
Right.
But in countries such as Italy, where we have socialist medicine, which is what some of these politicians want to put in our country, they don't have the resources that we do. They have many, many people in very crowded places. And so if one of those patients has COVID-19, every other person in that room is going to catch it from this one infected patient. And we're going
Right.
to see masses of deaths. And I think that's what we've seen. So obviously, those countries don't have the equipment that we have. Those countries don't have access to the drugs that we have. Those countries, unfortunately, with a socialist system of medicine, are going to have higher fatalities. China, socialist country. Italy, socialist country. Look at the countries. and you'll
Right.
see.
I mean, there's some good things about socialized medicine and some bad, because
No,
I've taken
there's no good thing about socialized
Well, I've actually...
That's another
But,
one.
I will say that I've had all my shots in France because they were too expensive here. So I don't want to be bashing anybody because we all have difference of opinions. But yes, socialized medicine does mean that you have a little less of a healthcare system that we are accustomed to in the United States. We are used to having a better healthcare system here. I will say that. And yes, we do have a chance to stop this virus, but you're going to get it. I mean, another show might be about how it's even being, how people are even getting it. I'm not even sure it's even what they think it is.
Well, it's
just from asking the
interesting
questions,
that
and we have 2
Governor
minutes.
Abbott
So.
has come out and said we can put more patients in a hospital room.
2 or 3 in a
yet-
room, yes.
And yet we
It's a
know
wrong
that
thing.
is not.
So much for social distancing.
That's a bad idea,
That is not a
possibly.
good
Yeah.
idea from what we've seen in other countries. We've
Yeah.
seen the results of that.
And I'll tell you where you can get shots for cheap.
Well, let's do another show on
Yeah,
that, because
there we
after
go.
this is all said and done, I hope people are more aware of America and our medicine and how good we do have it here. And I think that our healthcare workers are doing a great job. Dr. Lozano, you're doing a great job.
Thank you.
And we appreciate everyone out there on the front lines doing whatever they can during this time, because there's a lot of panic, and I appreciate you coming on and telling people the truth.
Absolutely.
Thank you, Dr. Lozano. Thank you, Penny Story. I'm Rita Cook with ECP TV. Thank you.